Hello, everyone. My name is Kenny. I'm a fourth year medical student. I'm 15 months post stroke. And I'm going to talk about how to increase neuroplasticity after a stroke, or really after most likely any kind of traumatic brain injury or brain injury in general. So, neuroplasticity is a mouthful. So, for the duration of the entire presentation, I'm just going to call it NP. Everything I talk about is backed by five or more evidence based papers, and most have at least a systematic review or two that um, support the evidence. So first, what is NP? So the simple definition is easily you can easily find it on Google, and it's explained pretty well, even formally. So the simple definition is the brain reorganizing synapses and connections in the context of brain injury. So regardless of whether you've had a stroke or not, even outside of a stroke, your brain is constantly remodeling itself based on new things that you're learning and new things that you're seeing. So not just what you were born with, but the environment that you're in, the brain changes itself to adapt and to learn new things. And generally speaking, for the better. So before we try to do things that may increase recovery, we got to think about things you want to avoid. It's kind of like when you're trying to lose weight. Before you start, going to the gym heavy or running or doing whatever else, you want to think about things to avoid that will actually increase your weight. So you want to cut out things like bad food and daily beers or like pop, soda, drinking like that daily sugar as coffee from Starbucks, things like that. So we're going to apply the same concept and context to NP. So you want to avoid things like alcohol. Um, Other things that reduce NP would be specific like chronic conditions or poor health conditions in general. Diabetes is a very big one of the biggest because it's also one of the most common, and one of the biggest risk factors for stroke as well. Or anything else, honestly, that cause metabolic disorders or a metabolic disorder or things that cause metabolic derangements. So something like a poor diet is especially bad as well. So you want to avoid things that are high in like saturated fats, um, and honestly just aren't very nutritious. So things like the most obvious would be things like fast food or processed food from the outside, things that you don't really know 100% what you put in your body. Other things that affect NP and reduce it include neuroinflammation, the most common being infection and any additional brain injuries after the fact. Also, often not thought about is getting poor quality or not very much sleep. If you aren't very active, so you're not doing things that promote increased synapses of those areas of the brain that you're trying to recover, right? So just the old adage of use it or lose it really applies significantly post stroke. So if you're kind of just sitting around not using the affected areas, that's massive. And again, I am coming from the perspective more so of motor recovery because that's how I was affected. I'm not saying that there are plenty of other things that could be affected. And if that is the case, then that would also be the activities that need to be worked upon. And whoever the victim is should do more of. Other things that affect NP pretty strongly are honestly the mental state. So things like depression, anxiety, or unfortunately, a lot of people post stroke are also in a state of chronic stress, either secondary to stroke or you're not. I'm not really sure what quality of life the patient or person may have, regardless of the stroke, and whether they're struggling or have good social support or they have any other stressors outside of just a stroke. So chronic stress has negative effects on NP as well. So now that we've gone over all the things that reduce neuroplasticity or reduce NP, let's go over what increases NP. So when it comes to studies, the NP is usually approximated via a hormone called BDNF, also known as brain-derived neurotrophic factor. And by far, and there's a million and one papers out there that go over this, by far the best way to increase neuroplasticity, increase NP, is via exercise, especially after a stroke. So typically, high quality movements and high volumes of reps. Now, to be fair, I am very biased. I'm a little bit biased here in the sense that when I think of NP and recovery, I'm thinking of things from a motor perspective because my stroke affected me most maximally from a motor perspective on my left side. Anything from gross, which is larger motor movements, and then fine motor, um, the things that will help with any deficits in those regards and increase your NP is just movement and then doing as much as possible. So that's what I mean by the volume of reps. So everything on this page is relevant, but by far the greatest one that will increase the BDNF in your body system is exercise. Specifically, actually, even though it's not in here, high intensity exercise that gets you sweating if possible, because being moving to that degree after a stroke may not be easy or possible depending on at what level you're at with recovery. Interestingly enough, being social has been associated with increases in BDNF and NP. Also, sunlight increases NP as well. So as far as working out or doing things, just doing them outside when you're in direct contact with sunlight is is typically kind of more additive to recovery. So again, I mostly, when I think of NP, I'm thinking of it in terms of motor recovery, but some people are affected more so in other ways, especially cognitively. So anything that will give you cognitive stimulation will also increase NP in that regard. So things like puzzles or reading are probably your best bet, but really anything that makes you think, especially if it's something that you're bad at. For example, if your ability to do basic math has gone down significantly, it's probably a good idea to kind of start doing some practicing, practicing exactly that. Doing some, I don't know, little worksheets or things like that. Or anything that increases your cognitive load and makes you think. So doing puzzles and reading are probably two of the easiest and simplest things and easiest ways to start highly kind of loading that cognitive ability. Other things that help, and I've kind of touched on this already, but good quality sleep. I'm not really able to give a specific amount of sleep that someone should get, right? So that's individualized, and just really sleep that helps the individual feel refreshed, and feel good and ready to kind of approach the day after the fact, right? The stereotypical amount is 8 hours of sleep. Now, I can't say that is the amount you should be getting because it changes depending on everyone. And I'm not sure there are that many studies out there that look at specific volumes of sleep in association with increase in NP. So good quality sleep is probably pretty individual. So things like stress reduction, pretty much if you're in any state that increases your stress levels, try to get out of them or reduce them. Obviously, very much easier said than done, but everyone's at a different stage in how a stroke or any kind of brain damage has disrupted their lives. There isn't too much on it, but the few other additional things that do also increase NP, everyone is looking for a magic bullet, but unfortunately there is not. There's not one pill you can take that just shoots it through the roof or increases your NP max like crazy. So, but there are a few things that do help a little bit as far as kind of recovery. So specifically, fish and seafood nuts, green vegetables. I didn't put this on here, but also citrus fruits tend to be good as well. There are also a few mechanical devices like functional neurostimulators that would also increase your NP. So some of these are known as, though it wouldn't be functional at this point, they would just be kind of like your slap-on neurostimulators, like your E-stims. I think they're called V-stims, which you kind of just strap onto the muscle and then you turn on, and they stimulate the muscle. But functional neurostimulators are better, and there's more evidence for them because you can. The whole point is, as the muscle is being stimulated, you're actively using the muscle as well, which increases the NP and the way your brain is recovering even more than just kind of relaxing, just sitting there and just having your muscles fire for no reason. So evidence shows that stimulation of the muscles along with movement simultaneously is very, very good. So that's what I mean by functional neurostimulators. There are a few devices out there on the market, but if I'm being honest with everyone, they're very expensive. And there's obviously some bias with any device because they're on some level trying to make money. Though I've only really seen good reviews from people who have used the devices themselves. There are some uncertain factors where these things are there's evidence or there's less conclusive evidence on them. So supplements, and these can be billed as so many things. They're often advertised as just so many things that you never really know exactly what's in them. So things like nootropics, exogenous BDNF, which is a fancy way of saying like a BDNF pill, which I'm not sure is something that's really synthesized. Things like polyphenols, curcumin, omega-3 fatty acids. Actually, that one really shouldn't be there because omega-3 fatty acids are one of the few supplements that would probably be good for you. The problem with supplements is that instead of going out of your way to kind of buy them or ingest them, you can typically fulfill any supplemental needs via food. Just have to target the foods that you're going to go for. You can easily look up any of these supplements online and see what foods are high in polyphenols and curcumin and high in fatty acids, and just eat more of those or have those be a more complementary or larger part of your diet. Another big one is like caffeine and coffee. So this is kind of indeterminate. There's not a ton of evidence that would say it's notably good for an individual. And everyone has their own personal everyone has their own personal health issues that, maybe it may not be best to drink a certain amount of coffee, right? I don't know what pre-existing conditions anyone has. Personally, I have none, and I still drink coffee with no issues. I have brain damage, so I don't overdo it because caffeine in general affects your brain on some level. So there's no need for me to try to overdo it. So where I'm going with this really is there's not a ton of evidence one way or the other that says, this is good, so good for you or so bad for you. There seems to be a little bit of evidence that's essentially more good for you than bad for you because of the antioxidants in caffeine. Well, coffee really. That being said, this is the kind of thing you'd really want to talk to your doctor about because everyone has different stroke manifestations and different areas that were affected by their stroke. And I don't know what pre-existing conditions you as a patient may have. So regardless of whether you're doing this, just make sure you're kind of doing it, keeping it mild. There's no need to drink, even if you were drinking 3 cups of coffee before, which is pretty much what I normally would do, something like that. There's really no need to overdo it, so you try to maybe keep it to 1 or less. And then a big one is hyperbaric oxygen therapy. So there's some evidence out there, but it's not very consistent, and there's not a large body of evidence, unlike other factors I've mentioned before. Right? There's not a ton of papers out there that are overwhelmingly, showing evidence for hyperbaric oxygen therapy being good for stroke recovery or being good for NP. So a lot of the things you might see out there, they're usually made by private entities which have a conflict of interest, and a lot of hospitals and areas don't have this kind of therapy available easily. So therefore, it's not something I would recommend. Also, keep in mind that I'm still just a med student, and even as a med student, this is not like an area of particular interest in mine. Outside of course, having a stroke, now I have to care because I don't have a choice. So really, try not to make any conclusive decisions based on anything you hear here, and this should just be, if anything, um, learning points that you might want to bring up to your physician and see what they have to say and if they what they know. So kind of as part of what I was just talking about, the uncertain factors, I stay away from supplements, and I did pre-stroke as well, just because ultimately, in my opinion, and from what I see and everything, these are really just a money grab. And for the most part, they're not really required unless there's an objective deficit that your physician or neurologist or whoever has seen in your labs, right? If you're on low in vitamin D, then yes, you probably take vitamin D. There's no need to take it to super therapeutic levels though, which is like levels that are above what is in a normal physiologic range. You should keep all your levels roughly in the same physiologic range. There's no need to go over and above. And some of those things do have complications. You can overdose in certain vitamins as well. And for the most part, there's not a ton of evidence that certain vitamins will, again, improve NP in particular, outside of some of those that I already mentioned. So I stay away from supplementation because ultimately a lot of them are they're just trying to get your money, right? Um, some of them may not be, I mean, maybe they are, maybe they aren't. Some of them are not FDA approved, but they can advertise and say there to the laws and rules and advertise and say whatever they want. And you're in a bad place, right? This is probably some of the worst times of your life. You may or may not be willing to throw money at anything that you think will make you better. But again, there's no magic pill. The best recourse overall is still exercise. And doing that same thing over and over and over again. It sucks. So like I said before, HBOT stands for hyperbaric oxygen therapy. Again, they're really just, from what I've seen, and there's not a ton of evidence for it, they're really just there to try to get your money. Right? Again, these people, they'll set up maybe or advertise to you, come do X sessions with us. This helps with stroke or helps with all these other things. And again, I can't call them out massively because, if I'm being honest, I don't know that much about HBLT. That being said, the actual evidence that I've seen, the papers I've read, there's not a ton of evidence for it. And it's not even widely available either. So this is my body, it's my brain. And if there's not a lot of evidence for it, I don't want to put myself under it. And these things are not cheap either, right? Even if it is something that's available in your area, you would have to pay through the nose for it. And you better believe insurance will not cover this. So I've said a lot and I've rambled quite a bit. The big takeaways from all this is really just avoid things that reduce NP. Typically, the big things are something like drinking and a bad diet. So really just try to eat well. And then things to do, exercise. Try to get your movements to be high quality movements and high volume. Do a lot of it. Once you're able to get that high quality movement in for whatever joint, whatever muscle group, I'll do a lot of it. Or same thing with cognitive stimulation as well. If you're able to read and you like reading, don't read a little bit. Read a ton. Get as much back as quickly as you can. To be fair, everything that I've said is much easier said than done. Also, keep in mind that my deficits are mostly motor, and they're not that bad right now. So I'm very biased in the way I made this presentation as well. And I focus mostly on those kinds of things that kind of affected me more so than others. Nothing here is meant to be taken for sure, oh, this information is 100% accurate, I can just go with it. Though I did my best to do as much research and read as many papers as I could and summarize and simplify it. That being said, you should really bring all these things to your physician and talk about it. Right? So don't take my word as bond. I'm just a fourth year med student.